Millions of Americans suffer from pinched nerves in the neck. When pain, tingling, numbness, or weakness cannot be stopped with time and treatment, surgery may be the answer. Hi, this is Dr. Dave Campbell bringing you the news in my field, spinal surgery. While no one wants an operation on their cervical spine, when needed, the risks have decreased and the rewards increased over the years. But the decision whether to replace a diseased disc with a mobile implant or one that results in bone-to-bone healing without motion is closer to being answered. The results of longer-term studies are suggesting that cervical total disc replacement surgery is at least as safe and durable as the gold standard, anterior cervical discectomy and fusion. In 2007, the FDA announced the first round of approvals for disc replacement surgery. Disc replacement surgery in the neck and the low back is available, but the risks associated with removing the rare implant are much higher in the lumbar spine. Discs that do not work properly in the lumbar spine have caused the reset button to be hit for the low back. But the neck is a more forgiving biological area. The mere fact that the head only weighs 10 to 15 pounds exposes disc replacement implants in the neck to much less mechanical force. For the low back, the hips, and the knees, bearing nearly the entire body weight can be a stressful situation. Until recently, implants were only approved for a single spinal segment, that is 2 vertebrae and the intervertebral disc between them in the neck. One company now has implants approved by the FDA for use in 2 sequential cervical discs. A slight increased risk of other discs degenerating prematurely after fusion surgery led to the scientific investigations and inventions of spinal disc replacement. The very long-term studies like those for hip and knee replacement are still pending in the United States for the spine, but patients having a choice in their own healthcare options is a good thing. Whether fusion or disc replacement, the results of cervical spine surgery to relieve neurological problems in the arms, even the legs, when the spinal cord is damaged, are generally good. Modern techniques of anesthesia, advanced preoperative imaging with MRI, that is magnetic resonance imaging, and the evolution of surgical techniques and implants have made spine problems less of a nightmare than they were back when I was a medical student. The future is bright as scientific advances are made in the prevention and management of spinal injuries and diseases. Some of these are that we have learned that avoiding smoking helps to preserve bone, disc, and even spinal cord functioning. Stem cells are on the horizon for helping treat spinal cord injury and paralysis. Other biological injections and treatments for spinal disease and injury are being actively studied in the U.S. and abroad, including in my hometown, Jupiter, Florida. But the mainstay to keep your spine healthy remains a wholesome diet with weight control, keeping active with physical activity and exercise, and very importantly, avoiding tobacco, avoiding too much alcohol, and avoiding the inappropriate use of drugs or medications. Thank you. This is Dr. Dave Campbell bringing you this very important message on your spine.